Auzubillahiminash-shaytanir-rajim. Bismillahir-rahmanir-rahim. So welcome back, guys. Today we're going to have a short discussion on the GTG number 71 that discusses the inherited bleeding disorders in pregnancy. So we're going to start with the von Willebrand disease. It is the most common inherited bleeding disorder. Its first stage of incidence is 1%, which is very significant considering the other things, considering Orbs coli, whose incidence is 0.7%. Okay, so 1% is significant. And what is von Willebrand factor? It's a large glycoprotein and it has two portions. One is the antigenic portion and other is the ristocetin cofactor. So when you are going to assess for the ristocetin cofactor, that is going to tell you about the quality. And when you're going to test for the antigen, that is going to tell you about the quantity. So it's a very important thing that we have the quantity for this factor and we have the quality for this factor. And for quantity, we check the antigen level, and for quality, we check the ristocetin cofactor function. And the norm, we're going to come back to this, but first, normally in pregnancy, this level rises. In pregnancy, what happens to factor 8? Factor 8 increases. And what happens to factor 11 and 9? They are not that much changed. What happens to von Willebrand factor in pregnancy? This von Willebrand factor rises 3 times in pregnancy. It rises by 3 times in pregnancy because there are 3 letters, 1, 2, 3. 3 letters in von Willebrand, so it's going to increase 3 times and then it drops around the day 3, postnatal day 3, it drops. So it's all a story of 3. Okay, and what happens is that there are 3 categories. So for von Willebrand disease, we have the story of 3. It increases by 3 times in pregnancy and falls back by the 3rd postnatal day, and it has 3 categories, 3 types. Now type 1 and type 3 are quantitative, okay, and type 2, whereas type 2 is qualitative. Okay, I just need another page. Okay, so we are doing its classification. Type 1 and type 3 are both are quantitative. Their quantity is increased, the level of the antigen will be decreased. But in type 1 it's autosomal dominant, but type 3 is autosomal recessive. Both are quantitative. In both of these, the quantity is decreased, but the main difference is that type 1 is dominant, whereas type 3 is autosomal recessive. And in type 3, the quantity is so much severely decreased that we say that there is complete absence. We're going to cross it. There is complete absence of von Willebrand factor in this category. And because of this, factor 8 level also decreases. Why does this happen, I wonder? It's because what was the function of von Willebrand factor? Its one function was to stabilize factor 8. One function was to stabilize factor 8 and the other function was to cause the adherence of platelets to blood vessels. So when it is almost absent, who will stabilize factor 8? Nobody. So what will happen to factor 8? Factor 8 will also decrease. So that is why in the category 3 of this disease, in type 3 of von Willebrand disease, factor 8 also decreases. And there is complete absence of the von Willebrand factor itself. Okay. And now what about type 2? Type 2 is qualitative. It's a quality. We should know which is quantitative, which is qualitative, because then we are going to discuss management. It's going to be very important. So it's qualitative disease, and it has 4 further subtypes. They are simple alphabets. They're easy. We all know alphabets A, B, and M. Okay. There is something wrong with B. In all of these, you can give desmopressin for management in the first 2 categories, but in case of B, you cannot give desmopressin. If you give desmopressin in B, that is further going to lead to thrombocytopenia. Okay, so no desmopressin for 2B category. Into A, into N, into M, you can give decimal present. In type 1, you can give decimal present. But in type 3, you cannot give decimal present. Why? Because there is no von Willebrand factor. That factor is not produced. That factor is not present. Decimal present was going to release the stores of von Willebrand. But if von Willebrand is not present anywhere, then what will decimal present do? Nothing. So it's useless in category in type 3 and in 2b. Okay, so this was the classification.